João, thank you very much. And I'll start with, I'll pick up on those words and maybe mention the omnipresent Cristina and the multidisciplinarity that all of these future cities involves. And if you see, this is Future Health. It's a specifically funded project in the framework of Future Cities. And if you see over there, you see three faculties, different faculties of the University of Porto, Sciences, Engineering, and Medicine, but these are only the formal members. Okay, the Faculty of Psychology, you'll see some of it in one of my slides. The Faculty of Fine Arts, you'll see a lot of it in one of the prototypes that we see over there, and even the Faculty of Humanities, which was a discovery for me, is somewhere over there too. Okay, so this is the only way that we could address this very arrogant name called Future. We arrogantly called it Future Health. And how did you attack this? Well, let me tell you a few stories. Okay, the first thing I need to tell you is the vision. Okay, if you call something Future Health, that can mean so many things. So what exactly do we mean by this? Okay, we mean we start with, like an engineer, we start with technology. Okay, we like really cool toys that technology brings us, and we have access to fantastic toys at the moment. The maturity of portable, of wearable sensors that we can use somehow for healthcare is really, really interesting at the moment. Okay, we can grab these signals with high quality, we can transmit these signals with high quality, but we still don't know exactly how we can use them to shape the future of healthcare. Okay, and so one of our first concerns was, how do we make the end user use this, and how do we make the end user use this and produce data with enough quality to be used for deciding, hopefully, people's lives and their health. Okay, so this is the first part. How can we grab these sensors, how can we choose the best sensors, evolve the sensors, and wrap them up into interactive systems that the end user can use effectively? Okay? And after this, we have a second challenge. Okay? If we get data from all these different sources, how do we ensure interoperability? How do we avoid a Babel tower that no one knows exactly, and all these myriad of very small systems that never communicate? Okay? So the second challenge we had to address is, how do we unify this into a single electronic health record? Okay? And for what and for whom? And, well, in our vision, there are multiple visions here, and in our vision, the end user that we explored here is actually the doctor. Probably the GP, maybe the specialist, maybe the nurse, okay? But it's clearly a health professional that we have addressed in this project, okay? It's a very big project. There's all these research lines, all these papers, all these teams, so I'll keep it simple and focus on a few things. I'll focus on who were our end user partners. They were fundamental to the numbers I will present to you. What was the technology? Which technology we had before? How did we evolve it? And how did we shape it into this vision? Okay. Then results. I mean, facts are always very nice and very illustrative of the success of something. I'm very happy to be, well, coordinating such a large team and such a competent team that I think we have obtained some quite interesting numbers. Hope you share this vision with me. And then a bit of, which is also, we believe it's also important, especially in the framework that our nation believes we should see science, and we will see a successful case of technology transfer and of a startup company that is exploring some of this technology and taking it outside the university. Okay, so the first end user partner that we had the privilege to work with was a primary care center in Portugal, near Valadares, USF Nova Via. This is a very interesting primary care center. Dr. Moura Relvas is the person that opened this door for us. It serves a region of around 15,000 people. And it has some special characteristics because they perceive innovation and improving things and research as part of what they should do. And so they have an unusually large number of interns. They do drug trials, and we were very pleased that they actually accepted to deploy this technology, evaluate it, and see how can we use this for proper healthcare. Okay. The second one is a long partnership we had. It's actually the largest hospital in Northeast Brazil. Okay, it's a huge hospital, serves a very big region, coordinates one of the largest pediatric cardiology telemedicine networks in the world. And so this was a great opportunity to also deploy technology there, to cross the Atlantic and measure things and see what can work. Okay, so some of the really nice results, I have to thank it's Doutora Sandra Matos, coordinates all these. For 8 years, we've had the privilege of cooperating, and I hope that for at least 8 more, and this has been a very successful partnership. So this is another one of our end users. Okay, so technology. Which technologies did we address? There are so many. Most of them you can actually see there and go and test. Most of them is not exclusive to this project. We'll see Sense My City, like Professor Ana Aguiar has shown in 7 projects. We were lucky to be one of them. And so let me give you a quick hint and an invitation to then test it of what we did. Okay, one is called Digiscope. Okay, it's how we try to understand how electronic stethoscopes could help us do something more with the fundamental part of medicine, which is auscultation. Okay, and so we had to create how do we systematically obtain an electronic health record with this. Doesn't exist at the moment. How do we make a system that uses this as simple as possible to use by anyone, that can actually grab a high quality auscultation, usability, okay, another challenge, and then signal processing. How can we integrate a bit of intelligence on these machines that help screening and diagnostic processes, okay? One technology. Second technology, Sense My City. I think I will not repeat what Anna said, but you know, this was a fantastic technology that covers one of the axes, which is the continuous wearable monitoring, and this is part of what we used. We've done crazy stuff. We've done compressed sensing for biosignals. We're trying to, you know, use information theory to be able to save battery when transmitting signals, and we did this for electrocardiograms. Bit of a more detached experience. Here's a very famous professor from the University of Porto, present in the audience, which this was a new technology that we didn't have before. We didn't even think about this before, but as the project went by, we understood, hey, this, you know, that there's all this technology, and the end user wants this. So I'm very jealous, because while I lead the digital auscultation part, doctors find this much more sexy. So I'm maybe not so happy that I invited them to this project. But this has been, as you'll see the results, this has been very recent and very successful. So congratulations to them. Open EHR, so okay, this is all great, but interoperability is an important thing. Open EHR is one of the open standards that people are trying to push, so we can have interoperability across the planet, and then we had to develop this associated with future health. Okay, great, we have this technology, so what have we done with it? What actual results did we get? Well, we're academics, so here's the academic numbers. Okay, this is a funded project, and we met all the objectives we had proposed to: conference publications, journal publications, training, including postdocs, PhDs, and master theses. We've presented again and again. I mean, there's 6, but I think there's many more there. This is what I wrote on the final report, but because it was enough, but I think mentally I counted maybe 20. Okay, and then numbers of actually real use by end users. And we obtained more than 3,000 auscultations using Digiscope, 1,000 users using health kiosks, and 150 hours, 17,000 events recorded by Sense My City. So I mean, they are, you know, I have to say they're pretty impressive, and they're impressive enough that we've been invited for several projects just because of this ability to generate all these health data that can be used for research, or for public health policy, or for stress analysis. This is, I think, the best judge that people find this interesting. Okay, so regarding Digiscope itself, we've deployed it for the first time in Brazil. It's an event called Caravana do Coração. This is 2013, 13 cities in 13 days. They screened around 1,000 children for cardiac pathologies. When they, I mean 40 professionals, 2 drivers, I don't know how many nurses, cardiologists, etc. And they did this in the state of Paraíba, screening all these kids. We were not present. We just sent the technology, and Cicera is over there using our technology. She is the nurse that has used all this, and she did 500 auscultations where we validated the ability, the technical ability to actually record these sounds in a tablet using wireless transmission, etc. Okay. 1 year after, there's a very famous researcher that went to Brazil and survived. This, fortunately, is one of the. This is actually the last patient, I think, that we did. We did 1,000 patients. Okay, we were one of the stations that were present there. 3 elements from the University of Porto. I did 300 auscultations myself, and I'm not a doctor, so how did I do this? Well, this was the phase that we tested the interactive system, the auscultation for dummies. Can anyone, without training, do this effectively? And results showed yes. Okay, it took us a while. It was the 5th iteration in 8 years, but we finally obtained something that can be used in the field, and taught very, very quickly. Okay, I don't know what I heard, but I know that I collected the data and that doctors using telemedicine, etc., can use it. Okay, this was also worked on a smaller scale here in Portugal, in USF Nova Via. It takes time to get all the ethical committee clearances. This is extremely important. So you have to do this exactly by these processes, how to anonymize, what are you going to collect, etc. So that means in the end of the project, we only have 200 users. We'll count on many more in the near future. Okay, and then this was the final result. In 2015, again, we went to Caravana do Coração, another very famous researcher, postdoc, Ana Castro, and back there is a PhD student, Pedro Gomes, and we did 1,000 users. So what was the next level that we did here? We did signal processing, okay? So besides gathering all the auscultations, we actually, as a proof of concept, screened pulmonary hypertension. We're digesting all the results, but they're apparently quite successful. So if you want to check this, you can talk with Anna and go and check this in the demo session. But this is, steps towards making this useful for, healthcare. Okay, since my city, I did not spend many slides here because Anna has shown very, very impressive numbers on this. It was also used here, and even with just 10 users, we collected a lot of hours of data, and all this data then we had to integrate in that electronic health tracker. So we had to think, what can we extract here that makes sense to a clinician? How do we make this work? So obviously more steps have to be done, but we did it. And finally, the health kiosk, which is the technology I'm, a bit angry at, because they only started, the first deployment was 2015. They started working this maybe January, December, I don't know. And we challenged them to say, hey, test it in the Mostra of the University of Porto, because you need usability is a fundamental thing for a health kiosk. Think an ATM machine where I can go and do self-tests. And this has to work for any age, any type of education, with illiterate users, such as the ones we found in Brazil. Okay, how do we do this? Usability challenges are tremendous, and so we had to deploy and deploy and deploy and deploy. And they started here, and then thanks to Cristina, she opened up 2 opportunities because she actually wanted the data, and so we did this in Feira da Saúde in Feb, so in March again. Then we did in Câmara Municipal de Paredes, 119 users, different things, City Hall employees, university students, high school students, parents, grandparents. Okay, so we tested this on a variety of users, and this was the highlight. Again, we explored the opportunity to work with this partner, work with this telemedicine network, and that's Pedro Brandão, one of the coordinators with Professor Rui Prior of all this line, and he went there. And there's our technology, and we screened 500 users. Not the children, not the pregnant women, such as Digiscope, but the parents, okay? And we are, again, digesting all these results. This was July 2015, and hopefully, going forward with this, we have been invited to 2 proposals already, which were submitted, waiting for funding. Third one is in preparation, so this is a strategic line we're clearly attacking with a lot of, energy and enthusiasm. Okay, and just to finalize, all very important technology transfers. So this is a startup company from the University of Porto. This is a photo from last week. We were on Tech Days in Aveiro, and this is the stand. That's Pedro Gomes, a PhD student and the CEO of the company. Another PhD student has been integrated. It's Daniel Pereira, and the company has already sold some of this technology and is looking at other perspectives. So we're all rooting very strongly for them. But I think this completes a bit the arch that you do all the research, you do all the technology, we evolve it, and then if you want to actually change the future of healthcare, you need companies to be your muscle that actually does this. Okay, so that's it. Keep in touch, and you're invited to most of these demos over there in the end. Okay.
Thank you very much, Miguel.